Thank you, Stuart. And it is my immense privilege to talk to you today at this wonderful, inspiring conference, and it's been great. Thanks, APNA. What a wonderful experience it's been so far. So having represented APNA as a member of the Obesity Guideline Development Committee of the National Health and Medical Research Council, I was hoping to inform you today about the new clinical practice guidelines being released, but unfortunately this is not quite the case. However, they are being prepared and they will be released soon. Meanwhile, I'll continue to give you a bit of an insight into what is to come. Now, these guidelines will assist healthcare professionals in managing overweight and obesity in adults, adolescents and children. And having been in development since November 2010, the new guidelines will be a user-friendly follow-on from the 2003 guidelines that unfortunately had little uptake in practice. The best evidence available during development was graded. Practice points and recommendations have been made, along with checklists and case studies. Maybe some of you read the draft when it came out for public consultation earlier. Now, I am currently representing APNA as part of a working group to disseminate and implement the latest 2011 smoking cessation guidelines for the Royal Australian College of General Practitioners. Recommendations for these guidelines were made with a strong evidence base. And when choosing my slide colour format, I realised that this colour actually reminded me a little bit of plain packaging. A bit dull perhaps, however that's what it's all meant to be about. However, hopefully over time plain packaging will impact on deterring people, especially young people, from smoking. And just a little plug, there will be a survey from the RACGP on the latest smoking cessation guidelines where you have the chance of winning a $200 gift voucher if you enter. So look out for that one on the e-news. In briefly dovetailing both guidelines, we can see the effects of overweight, obesity and smoking are widely recognised as two of Australia's leading health concerns involving various ages and socioeconomic groups. Overweight and obesity in Australia has been steadily increasing in the last 30 years, and 63% of adults and 1 in 4 children in Australia are overweight or obese. 15.1% of people in Australia aged 14 years or older are daily smokers. Obesity and smoking are particularly prevalent among those in the disadvantaged and lower socioeconomic groups. Health problems related to excess weight and smoking impose substantial economic burdens on individuals, families and communities. Now, an AusDiab study on obesity estimated an overall total cost of $56.6 billion, and the cost of smoking on society in Australia is $31 billion. Now that's a lot of money that could be put to other uses. Over 80% of the population visit a GP at least once a year. Doctors in a position to identify and then maybe refer to primary healthcare nurses patients they find to have risk factors or chronic disease relating to either issue. There is evidence to suggest that seeing a primary healthcare nurse can be very effective. Now, a Cochrane review in 2009 showed that nurse intervention can significantly reduce the likelihood of quitting smoking, and according to Galini in 2007, lifestyle interventions can be efficacious in the mid to long-term treatment of obesity, leading to significant reduction in body weight and cardiovascular risk factors. So with appropriate counselling and proactive follow-up and support, there is potential to double the effectiveness of GP advice compared to self-help materials. And of course, since the implementation of the practice nurse incentive payment, it can be economically viable in general practice for nurses to run clinics to assist patients with either issue in preventing the possible development of chronic illness that can result from overweight, obesity and smoking. Now, both issues require long-term and ongoing relationships with healthcare professionals in order to foster motivation and confidence to make change. Now, in order to change behaviour, patients need to believe that the benefits of change will outweigh the costs of continuing their risky behaviour. Now, in my practice, I've actually personally downloaded the smoking cessation guidelines onto every desktop of clinical use in our practice so that they can be at everyone's fingertips. They've got no excuses when they say, oh, I don't know about those. So I've made sure they know about them. And I plan to do that once the obesity guidelines are released as well. So maybe you'd like to think about doing something like that in your practice. Okay. If you've utilised LifeScript's resources in your practice, I hope a lot of you have because they're very useful, you may be familiar with the 5 A's framework. Now, this framework, commonly used in primary care, runs throughout both the guidelines. Ask about current lifestyle behaviours, previous weight loss and or quit attempts. Assess by routinely assessing, monitoring and documenting body mass index, waist circumference and smoking status. Advise by promoting the benefits of healthy lifestyle. Assist in setting up a weight management and or smoking cessation program to assist in making specific, measurable, achievable, realistic and timely, or better known as SMART, goals for behaviour change. And arranging referrals to other allied health, as we often do in care planning, such as dietitians, exercise physiologists, psychologists, the quit line, and arranging for follow-up to monitor and review long-term weight management and smoking cessation support. Now, Dr. Colin Mendelsohn will be expanding on the smoking cessation guidelines shortly. I'm going to continue on with a little bit of an overview of the obesity guidelines with what I can tell you at this stage. Overweight and obesity in Australia has been steadily increasing in the last 30 years, as I previously mentioned. And from my experience, I have found that addressing overweight and obesity with patients, for them, it can be an extremely sensitive and emotional issue. The guidelines have been designed to use primarily at the level of the individual who is overweight and obese, while acknowledging that individual choices are shaped by the wider and environmental social context. The evidence-based recommendations and practice points focus on physical and clinical aspects of care and are designed to help nurses and others apply the appropriate level of weight management care. Now, the underlying principles of care need to be centred on the needs of the affected individual, that it is culturally appropriate, non-directive and non-judgmental, and that it enables people to participate in informed decision-making at all stages. Despite guidelines recommending measuring waist circumference in addition to body mass index be routinely measured every 2 years, Australian data suggests that this only happens about 10% of the time. It's not a lot, is it? Current Australian guidelines recommend waist circumference to be a good predictor of total body fat, a useful predictor of visceral fat, and chronic disease such as cardiovascular disease and diabetes. Routine assessment of BMI and waist circumference aims to identify people who may benefit from advice about weight management. Willingness to make behavioural changes is a key factor in targeting interventions. To assess the person's interest and confidence in change, possible barriers and available sources of support, the right questions need to be asked. Now, for example, you need to ask about a patient's weight history, including previous weight loss attempts. It's amazing what people will try to get that weight off. And anyway, in the longer term, it is important to manage attitudes and expectations about weight loss and regain, and to continue to encourage lifestyle changes. Discussing the benefits of weight loss is part of the routine care of people who are overweight or obese. The core message is that even small amounts of weight loss, be it 2 to 5 kilos, can bring health benefits. Even if no weight is lost, lifestyle change that includes less energy intake and more physical activity is likely to have some health benefits. Quality of life and self-esteem may improve, and depression may be reduced even with small amounts of weight loss. Lifestyle approaches are well suited to delivery in primary healthcare settings, and as I mentioned earlier, specific tools such as LifeScripts, as well as knowledge of local service providers such as the hydrotherapy pool and its timetables, local gyms, community programs such as Healthy Living Networks, and activities such as the Heart Foundation walking groups, heart moves or Tai Chi classes, and these can assist health professionals to refer appropriately. And we have a continuing role in monitoring and reviewing our patients following referral to allied health, as previously mentioned, or for further intensive interventions such as very low energy diets and medication under medical supervision. Multi-component interventions that address all three lifestyle areas relate to overweight and obesity. Nutrition, physical activity and psychological approaches to behaviour change are more effective than single interventions. Treatment goals should be focused on improved health rather than on weight loss, and I do tend to concentrate on this with my patients. For successful long-term weight management, people must overcome strong physiological responses that encourage weight regain, as well as resisting a return to weight-promoting lifestyle habits. A self-management approach is required, involving continued lifestyle change, strategies for regulating mood, frequent monitoring of weight and catching lapses before they become large-scale weight gains. And primary healthcare professionals, especially nurses, have an important role in monitoring to review behaviours, providing continuing support, reinforcing lifestyle and behavioural advice, and discussing intensive interventions if needed. So in summary, for adults, long-term management of weight and regular monitoring is, if required. For people who are overweight or obese, weight management for detailed... I've gone too far. Weight management... Anyway, I'll just keep going. Successful strategies involve some form of continuing lifestyle change, and a tailored approach is likely to be more effective, as success is highly dependent on personal variables. Goals should focus on behaviour change and improved health, as well as weight loss. For most overweight and obese adults, weight loss of 5% of initial body weight is achievable and reduces health risks, including lowering blood pressure and reducing the risk of delaying the progression of type 2 diabetes. And the benefits can increase exponentially with further weight loss, particularly in people with obesity. Now, for children and adolescents, most that are overweight or obese can be identified through primary health care. Weight maintenance rather than weight loss is recommended for children, and many adolescents to allow children to grow into their weight. The focus should be on promoting healthy behaviours to families that involve reduced energy intake through healthy diet, increased physical activity and less screen time, such as, well, we know TVs, iPods, iPads, computer screens, to name a few. And we need measures to support behavioural change. Lifestyle interventions should engage the parents, carers and family, and frequent contact with a healthcare professional is beneficial. We need to encourage breastfeeding in infants. Referral may be required for post-pubertal adolescents who have severe obesity and obesity-related comorbidities. And in these circumstances, the management goal is weight loss rather than weight maintenance, and additional interventions may be warranted. The overweight and obesity guidelines need to be used in conjunction with the latest Australian dietary guidelines and physical activity guidelines. So I suggest you familiarise yourself with these guidelines as well. And as you can see, the physical activity guidelines are actually currently under review, but you can still utilise the previous ones. As primary health care nurses, we are ideally placed as a first point of care to identify, assisting in the treatment of individuals in relaying health messages. It's been shown that nurses can effectively address both weight management and smoking cessation. We tend to have a bit of the luxury to be able to afford more time than most GPs. They don't have the time for a lot of detailed counselling in weight management and smoking cessation. Patients can tend to be more open with nurses. I don't know if you found that, but I have. We have contact with the target group. We have respect and are trusted and credible health professionals. We can expect accountability. We have continuity of contact, and we have the knowledge. And there are several ways we can implement these guidelines. They can be referred to during a broad variety of nurse-led clinics, either formally or opportunistically. Unfortunately, under Medicare, neither obesity nor smoking is classified as a chronic disease on its own, however, the guidelines for either issue can help us expand our scope of practice and assist us to be more confident in delivering appropriate advice about either issue. Nurses have the opportunity to address the big picture and be the coordinators of our patients' holistic care, addressing their individual needs. And I recommend that you consider specific training in motivational interviewing and maybe smoking cessation if you haven't already done so. Contemplate setting up a clinic for either of these issues in your own practice. So in closing, the influence healthcare professionals, especially primary healthcare nurses, have on patients is immense. If we wish to assist our patients with either weight management or smoking cessation, we need to also look at our own health behaviours. Are we being good role models for our patients. We need to read these guidelines, take them on board and use them to our advantage to not only help to empower our patients to lead healthier lifestyles, but perhaps even empower ourselves to lead healthier lifestyles and never give up on our endeavours in either way. And now you can see there's some websites there for various guidelines. Once the NHMRC overweight and obesity guidelines are released, they will be available on the NHMRC guidelines portal. And if you'd like to be notified when they are released, please send an email to the address on the slide. And no doubt APNA, when they are ready, will notify us as well. Thank you very much.